No, reading. High volume reading.
You should read that.
Nazilarifana reading.
Patient identification. Choosing the patient position. Remove the cap from the needle. Put a pillow under the patient identification.
Introduce yourself. Ask the patient's name and date of birth. What process should be the following?
Treatment of the venipuncture site. Hand treatment with antiseptic. Choosing the patient position. Remove the vacuum system from the vein.
Hand treatment with antiseptic.
Treat your hands with antiseptic. What process should be the following?
Assembling the vacuum system. Assembling the vacuum system. Choosing the patient position. Ask the patient to make a fist. Vein puncture.
Choosing the patient position.
Ask the patient to sit or lie down in a comfortable position. What process should be the following?
Remove the cap from the needle. Apply a pressure dressing. Choice of venipuncture site. Put a pillow under your arm.
Put a pillow under your arm.
Under the patient's arm, place a rubber cushion. What process should be the following?
Labeling of the test tubes. Apply an alcohol wipe to the venipuncture site. Remove the tube from the holder. Put on gloves.
Put on gloves.
Wear gloves. What process should be the following?
Labeling of test tube. Remove the vacuum system from the vein. Preparing the paving. Ask the patient to take a deep breath.
Preparing the baby.
Prepare test tubes corresponding to the test kit. Red, yellow, blue color indicators. 3 alcohol and sterile gauze wipes, plaster, bandage. What process should be the following?
Needle selection. Insert the tube into the needle holder. Ask the patient to take a deep breath. Make sure the patient sits in good health.
Needle selection.
Select the appropriate size needle. Make sure the label on the needle is intact. What process should be the following?
Choice of venipuncture site. Apply electronic wet. Ask the patient to make a fist. Examine the venipuncture site.
Examine the venipuncture site.
Examine the site of the proposed puncture. Is it possible to inject without a tourniquet? Presence of skin rashes. What process should be the following?
Ask the patient to take a deep breath. Insert the tube into the needle holder. Assembling the vacuum system. Apply electronic wet.
Apply it on the
Place a tourniquet 10 to 15 centimeters above the intended puncture site on a sleeve or disposable napkin. What process should be the following?
Ask the patient to make a fist. Remove the cap from the needle. Treatment of venipuncture site. Apply an alcohol wipe to the venipuncture site.
Ask the patient to make a fist.
Ask the patient to make a fist. What process should be the following?
Choice of venipuncture site. Remove the cap from the needle. Apply a pressure dressing. Ask the patient to take a deep breath.
Choice of venipuncture site.
Select the puncture site by palpation. What process should be the following?
Apply an alcohol to wipe the venipuncture site. Remove the cap vacuum from the vein. Treatment of venipuncture site. Insert the tube into the needle holder.
Treatment of the venipuncture site.
Treat the puncture area with an alcohol wipe. Wait for the alcohol to evaporate. What process should be the following?
Assembling the vacuum system. Remove the cap from the needle. Make sure the patient is in good health. Apply a pressure dressing.
Assembling the vacuum system.
Assemble the vacuum system. Screw the needle into the needle holder. What process should be the following?
Vein puncture. Apply an alcohol to wipe the vein puncture site. Remove the tube from the holder. Remove the cap from the needle.
Remove the cap from the needle.
Remove the protective cap from the free side of the needle. What process should be the following?
Fixation of vein with a finger. Make a few wiggling movement with the tube. Make sure the patient is in good health. Loosen the tourniquet. Unclench your fist.
Fixation of a vein with a finger.
Fix the vein by pulling on the patient's skin. What process should be the following?
Ask the patient to take a deep breath. Apply an alcohol wipe to the venipuncture site. Insert the tube into the needle holder. Remove the tube from the holder.
Ask the patient to take a deep breath.
Ask the patient to take a deep breath. What process should be the following?
Vein puncture, make sure the patient is in good health. Remove the tube from the holder, loosen the tourniquet, and clench your fist.
Vein puncture.
Continuing to fix the vein, gently puncture it until you feel a hit in the void. What process should be the following?
Insert the tube into the needle holder, remove the vacuum system from the vein, remove the tube from the holder, labeling of test tubes.
Insert the tube into the needle holder.
Insert the tube into the needle holder as far as it will go. What process should be the following?
Apply an alcohol, wipe to the vein puncture site, loosen the tourniquet, clench your fist, remove the tube from the holder, labeling of the test tubes.
Tube from the holder. Labeling the test tubes. Labeling of test tubes.
Untimely action. Untimely action. As soon as blood begins to flow into the tube, loosen or remove the tourniquet. Make sure the patient has unclenched his fist. What process should be the following?
Make sure the patient is in good health. Remove the test tube from the holder. Make a few wiggling movements with the tube. Remove the vacuum system from the vein.
Make a few wiggling movements with the tube.
Untimely action.
Remove the tube from the holder.
After the blood flow has stopped, remove the tube from the holder, leaving the needle holder system in the vein. What process should be the following?
Make a few wiggling movements with the tube. Apply an alcohol, wipe to the vein puncture site. Apply a pressure dressing. Make sure the patient is in good health.
Make a few
Few
wiggling
movements
movements
with the tube.
After removing the tube, make a few jiggling movements. What process should be the following?
Make sure the patient is in good health. Apply an alcohol, wipe to the vein puncture site. Apply pressure dressing. Labeling of test tubes.
Applying alcohol wipe to the vein puncture.
Apply an alcohol wipe to the puncture site. What process should be the following?
Apply pressure dressing.
Labeling of test tubes. Make sure the patient is in good health. Remove the vacuum system from the vein. Apply pressure dressing.
Remove the vacuum system from the vein.
After the last tube is filled, remove the needle holder from the vein. What process should be the
Apply
following?
pressure dressing.
Labeling of test tubes. Apply pressure dressing. Make sure the patient is in good health.
Apply pressure dressing.
Remove the alcohol wipe from the puncture site and apply pressure dressing. What process should be the following?
Labeling of test tubes. Make sure the patient is in good health.
Make sure the patient is in good health.
Make sure the patient is in good health. What process should be the following?
Labeling of
Labeling
test.
of test tubes.
Label all blood sample tubes. Scenario completed.
Okay, 92%. We are understanding. You like it? Oh, virtual patient. And this is very easy, yeah? Okay.